Hello, welcome to ANA community. What do you mean by Nidana? What do you mean by Doshavikriti? And what do you mean by Vyadhi? What is the possible interrelation or interlink between Nidana, Doshavikriti and Vyadhi? How we can understand as per the present perspective? All these are the different type of questions when we hear the term Nidana, Doshavikriti and Vyadhi. This video gives us the overall outline of these three terminologies. This video gives us the overall viewpoints of Nidana, Doshavikriti and Vyadhi and their interpretations. When you think about the Nidana, the term Nidana, the most popular and authentic definition which may help us or which give us the probable meaning of Nidana as a causative factor, that is Seti Kartavyata ko Rogutpatak Hetur Nidanam. So Madhukosha commentary says this particular description. So here the term Seti Kartavyata kaha Kartavyasa iti, that is prakara. Iti kartavyam tasya bhavaha iti kartavyata tatha sahitah seti kartavyata. So that means whatever these different kartavya are being observed in the body, that is what we can say, that is vyapara vaivudhya yukto hetuhu nidanam. So that is the different types of the vyapara. For example, the ruksha guna in the exposure, that may have a different type of the functioning in the body. Ruksha laghu guna exposure, that may have a totally different functioning in the body. Ruksha and laghu and ushna, that may have a different functioning in the body. So like that, there will be different types of the functions, maybe in terms of the dosha vriddhi, maybe in terms of the dosha kshaya, maybe in terms of the imbalance in the dosha, or maybe maintenance of the dosha, etc. So these are the different ways of functioning that may happen in the body. So that is attributable to the Nidana as such. So further it is being mentioned that evam sati rukshadinam bhavanam vatadi prakopanam dushyanam ashayanam cha dushanadi rupa cha iti kartavyata vatadinam cha chaya prakopa prasara sthana samshaya dushanadi dushana rupa. So here the term kartavyata refers to the rukshadi bhavanam vatadi prakopanam. So that is the abnormal increase of ruksha, laghu, shita, khara, etc. of vata dosha, snigdha, laghu, tikshna, ushna, etc. of the pitta dosha, snigdha, shita, guru, manda, etc. of kapha dosha is going to get increased. That is considered to be the kartavyata. Further, it is being mentioned dushyanam ama ashayanam cha dushanadi rupa. So that is dushyanam, in the sense rasa, rakta, mamsa, meda, asti, majja, shukra. Ashayanam, say 7 ashayas are being mentioned, the pittashaya, etc., shleshmashaya, etc., etc. So that is considered to be the affliction of these happening in the body, or otherwise vatadinam cha chaya prakopa prasara sthana samshaya dushyadi, in the sense the affliction of the, what do you say, that the abnormal increase in terms of chaya of the vatadi dosha, prakopa of vatadi dosha, prasara of vatadi dosha, sthana samshaya vyakta and bheda, etc. So they are of the vatadi dosha that's happening. That is considered to be kartavyata. And where this particular kartavyata is happening because of the pre-existing factor, that is being termed as nidana. That is tasmad rukshadinam vatadinam cha nidanatvam. In that way, rukshadi ahara, etc. plus vatadi dosha, they are getting the term nidana. When you think about the nidana, basically 3 functions, abnormal functions that can be attributable. One, that is dosha prakopa. If the person is going to consume ruksha ahara, that will be leading to vata dosha prakopa. If the person is consuming ruksha ahara, there may be a possibility of rasadhatu dushti. And if the person is consuming ruksha ahara, depending upon the location, etc., there may be a possibility of kavaigunya. Suppose if the person is consuming the ruksha ahara, kavaigunya initially observed in the mahasrotas. So, as this particular ruksha ahara that is going to get accumulated in the amasha for longer amount of time, so kavaigunya specifically occurs in the amashaya at the beginning. In that way, so kartavya, the word kartavya, that is vividha vyapara, that's happening inside the body, that can be considered in this particular manner. As far as the understanding of Nidana is concerned, that is the three main key factors that can be considered here. That is source of entry of pathogen into the body. We are knowing that 9 bahya srotas are present in the males and 12 bahya srotas are present in the females. When there is entry of pathogens that is happening in the mouth, or that's happening in the nose, or that may happen in the eyes, that may happen in the ears, that may happen through anus, that may happen through urethra. In case of females, that may happen through vagina, or that may happen through breast tissue. In that way, the source of entry of the pathogens that may take place through these natural orifices. Second main key factor, that is the number of pathogens entering into the body. So that is less number of pathogens, mild manifestation of disease. More number of pathogens, more severe manifestation of disease. Third factor, that is virulence of pathogens entering into the body. If the virulence of the pathogens, if they are mild, so that is resulting in the mild form of the disease manifestation. If the virulence of the pathogen that is very potent, then that may lead to severe manifestation of disease as such. In this way, so the term Nidana, so that can be considered to have the different activities that's happening inside the body. Let us look into some of the different examples here. Suppose if the person is doing the cleaning of the dust. In this particular example, the lady is doing the cleaning of the dust as such. So here, the initial exposure of this particular dust will be into the nose, or into the mouth, or into the eyes and ears, and sometimes the skin that's being exposed. In that particular sense, depending upon the nature of the entry of pathogen, the person may develop the clinical manifestations. For example, if that particular dust is entering into the nose, the person may be having the sneezing. If this particular dust is entering into the mouth, there may be a possibility of the cough, etc., or dryness of the mouth may happen. If the eyes are being exposed to dust as such, the person may have the itching around the eyes or redness of the eyes that may occur. Ears are being exposed, of course, that may lead to dryness of the wax ear, that is the wax secretions as such that may happen. Skin that is being exposed, if he is susceptible to the the immune reactions, there may be a possibility of itching, etc., that may happen. In that way, the nature of the quality of the dust or quantity of the dust exposure into these natural orifices, they are going to determine the lakshana manifestation. But here, as the lady is covering with the clothes, the lower natural orifices, that is the anus, urethra, vagina, etc., they are not going to exposed into this particular dust as such. That's why the clinical manifestations are restricted to the natural orifices of the head and neck region as such. Let us look into another example. The person here is doing the exercise. depending upon the nature of the exercise, etc. Initially, the person will be taking the breath through the nose. So, and due to the exposure due to the continuous vyayama or exercise, then along with the nose, the mouth movement, that is the breathing through the open mouth, may also be possible. This occurs due to the air hunger. So due to that particular part, initially there will be changes that may occur in the internal environment. So that is, there may be a possibility of the water depletion. There may be a possibility of nutrient depletion. Initially, carbohydrate depletion. In a matter of 30 minutes later, there will be fat depletion. Then there will be protein depletion may take place. In that way, the stored fat that is present in the different subcutaneous tissues of the body, specifically buttocks, abdomen, breast, and cheeks, etc., the the conversion of the stored fat will be getting into the circulating fat. In that way, the simple amount of the exercise, depending upon the nature of exercise, that will lead to the dosha prakopa. Here, that will be responsible for the vata dosha prakopa in that way. The third example. In this particular example, the couple are in the intimate relationship. Different Mahya may be exposed to this kind of the Nidana as such. So here, in case of this particular type of the intimate relationship, usually the genital organs, they are going to get exposed to the different types of the Nidana. Then there may be a possibility of exposure of the mouth as such, depending upon the nature of sexual behaviors. That is, depending upon the nature of the foreplay, etc. In that way, the mouth, external genitalia of the intimate partners as such, plus anus and breast, they may be exposed to various etiological factors. So that means they may lead to the discomfort produced in those areas where exposure of these nidanas are being taking place. Let us take the one more example. Impact of apatarpada, one of the nidana that is being mentioned in the Ayurveda textbooks. Apatarpana refers to the removal of nutrients from the body to the exterior. So here the two examples are being given. That is, one that is the atapasevana, extreme left, and the other one who is doing the upavasa as such. That is, these two are considered to be the examples for apatarpana. Further, it is being mentioned 10 different types of the langhana here. Chatushprakarasam shuddhi, pipasa, marutatapo, pachanani upavasascha, vyayamascha langhanam. So here Chatushprakarasam shuddhi, that is Vamana, Virechana, Asthapanavasti, and Nasya. So they are considered to be Chatushprakarasam shuddhi. Pipasa, that is the thirst as such. Maharuta, that is exposure to wind. Atapa, exposure to sunlight. Pachana, that is amapachana. Upavasascha, that is doing the starvation or fasting. Vyayama, that is excessive exercise as such. So they are considered to be the different examples of apatarpana. Here what actually happens is this will be leading to the initial nutrient depletion, initially starting with the water and electrolytes as such. This will be followed by the carbohydrate, fat, and protein depletion that may take place. In that way, the Vata dosha prakopa may take place due to this particular the apatarpana as such. And when you think about the dosha vikriti, the term dosha refers to the dushana swabhavat doshaha. That is the tendency to vitiate the body. Hence, these components are being named as dosha. Sharira doshanat dosha, which are actually responsible for the disturbed functioning of the body. As they are having the tendency to vitiate the body tissues. If you are consuming the Nidana responsible for dosha prakopa in the balanced proportion, so that will not lead to disease manifestation. So, hence, this is considered to be dosha vikriti in the sense. So, that is abnormal increase of or abnormal vitiation of bioenergies. Maybe sharirika, that is either vata, pitta or kapha, or manasika, either rajas or tamo dosha, abnormal increase. Let us look into the examples. In this particular example, dosha vikriti as such, when you think about the image, he is in the Shita Pradesha. That is, he is in the cold climate or cold environment. If the person is having the exposure of this particular type of the environment, there will be a possibility of the entry of cold air through the nose, which may lead to dryness of the nasal mucosa, etc. Or otherwise, even there may be a possibility of dried secretions that may happen in the respiratory passages. And if the cold air is entering into the eyes, that may lead to the burning sensation or irritation to the eyes as such due to the reduced secretions that may happen in the eyes as such. And when you think about the skin, which may lead to peripheral vasoconstriction, in that way, the person may develop Vata dosha prakopa due to the exposure, excessive exposure to Shita guna, not only related to the natural orifices, whole body is being exposed here. So here the Vata dosha exposure may be, or Vata dosha vitiation may be to the maximum extent. In this particular example, the person is consuming the milkshake or the person is consuming the ice cream. When you think about it, so the person is consuming the ice cream, there may be a possibility of the entry of this particular ice cream to the different passages in the human body. Initially, that may be attributable to the entry of this ice cream into the alimentary canal from the mouth to the esophagus. Suppose if the person is speaking, in that way there may be a possibility of entry of this particular ice cream either into the nasal cavity, which is termed as regurgitation, or otherwise there may be a possibility of entry of this particular ice cream into the respiratory passage. In that way, the person may be having the clinical manifestations depending upon the entry of these nidana to the different passages. When the person is having this consumption of ice cream is happening into the alimentary canal, that may lead to reduced gastric acid or gastric juice secretion. Thereby, there may be a possibility of compromise in the digestive function. If the person is having the entry of these food substances due to the regurgitation, and if it is entering into the nasal cavity, there may be a possibility of the and the food that may come out through the nasal orifices, or otherwise the person may develop sneezing, cough, etc. If the same ice cream is entering into the respiratory passage, that may lead to cough, hoarseness of voice, etc. that may get manifested. Of course, this dosha vikriti that can be attributable to the contents of the food intake also. Suppose what particular food content that is present in the food that a person is consuming at that particular point of time. Is it curds, or is it sugar, or is it salt, or is it banana, etc. All these are going to decide the dosha abnormal increase in the body. In this particular example, there may be a possibility of the increase of kapha dosha in the body. When you think about the next example, if the person is exposed to hot climate, depending upon the nature of extent of exposure to the sun, to the body or body parts, the dosha vitiation that may be observed depending upon the nature of exposure as such. Suppose if both the feet are being exposed to the sunlight, that may lead to, what do you say, that the increased blood supply to that particular area, or there may be a possibility of tanning of the skin, etc. Our whole body are being exposed, as in case of the sun bath, etc. So there may be a possibility of abnormal increase of pitta all over the body. Or otherwise, there may be a possibility of, specifically in case of the summer season, then there may be a possibility of abnormal increase of pitta all over the body itself. Or such as cooking. In case of cooking, the possible exposure could be tvak and alimentary canal. In that way, the dosha vitiation that may be observed depending upon the nature of nidana exposure as such. In this particular example, the person is an agriculturist and he is doing the harvesting there. That too happening during the rainy day. Suppose if he is exposed to the heavy rain, he was not having the care. In that particular situation, the person may be presented with cough, breathlessness, etc. In that way, we are going to expect vata kapha dosha dominance in this particular occasion. Now, what do you mean by vyadhi? It is being mentioned that tatra vyadhiramayo gada atanko yakshma jvaro vikaro rogamityanarthantaram. So that is the term vyadhi, it's actually a relative term. Relative term in the sense, the one person may have the presenting complaint. When you think about the another person, he may be having the tolerating capacity of varying degree. He may not have the presenting complaint in that particular individual. For example, the constipation, the word constipation, that may vary to different individuals. The person who is suffering from diarrhea, the severity that may vary depending upon the individuals itself. That is why it is vyadhi is considered to be a relative term, which can be attributable to different kinds of the discomfort in the body. Either that may be headache, or either that may be pain in the teeth or toothache, or either the person may have vomiting, or either the person may have the bloating sensation of the abdomen, or the person may be having the bilateral, the pedal edema, or the person may be having abdominal swelling, or the person may be having the joint pain, or the person may be having the loss of strength in left upper limb and lower limb, like that. So these are the different types of the discomforts. They are considered to be vyadhi. So these are the different synonyms are being mentioned in Charaka Samhita. That is the vyadhi and the prayena avasamuthatvena amaya uchyate. So vividam dukkha madadati iti vyadhi. So that is various kinds of discomfort happening in the body. Hence this is being named as a vyadhi. Prayena amasamuthatvena amaya ityuchyate. Amaya, they are considered to be due to the presence of the ama in the body. Atanka iti dukkhaitatvena krichra jivanam karoti. Atanka, that is considered to be the difficult lifestyle because of the presence of various kinds of discomfort. As far as yakshma shabdena raja yakshma vad aneka roga yuktatvam vikaranam darshayati. Multiple diseases present in an individual at a particular time, the vyadhi is having the synonym, that is yakshma. Jvara shaddena deha manah santapakaratvam. That is considered to be the discomfort happening to the body and mind, that is termed as jvara. Vikara shabdena sarira manasor anyatha karanatvam vyadehi darshayati. That is vikara shabdena sharira manasor anyatha karanatvam. So that is the discomfort that's happening to the Sharira and Manas itself. That is being termed as Vikara itself. Roga Shabdena Roja Kartritvam. The presence of various kinds of the discomfort. Hence, the Vyadhi is having the synonym that is Roga. And when you think about the Vyadhi, it is having the wide range of the application itself. So that is, when you think about the Vyadhi, we are going to identify what might be the possible dosha vitiated in the body. Ruksha ahara, vata dosha prakopa. Snigdha ahara, pitta or kapha dosha prakopa. Snigdha, shita exposure. The person may have the exposure of the kapha dosha prakopa. Snigdha, stikshna, ushna. There may be a possibility of pitta dosha prakopa. So like that, dosha vitiated in the body that can be predicted by looking into the clinical manifestation itself. By looking into the clinical manifestation, we are going to identify what might be the possible dusha afflicted. Whether is it rasadhatu is afflicted, or raktadhatu is being afflicted, or mamsadhatu is being afflicted, or medodhatu is being afflicted. Suppose if the person is having the pain in the knee joint, we are going to say that the person may be having the affliction of asthi and majjadhatu. In that way, we are going to understand the dusha afflicted in the body. And regarding the srotas affliction, so that is, we have to identify whether it is Bahya Srotas is being afflicted or Abhyantara Srotas is being afflicted. When you think about the Bahya Srotas, depending upon the nature of exposure, the earliest clinical manifestations will be observed on the Bahya Srotas. Suppose if the person is doing the, what do you say, that the Adhyashana, the initial the discomfort will be observed in the mouth itself or the organs related to alimentary canal. Suppose if the person is having the exposure to dust, the Bahya Srotas initially afflicted will be nose. The next Bahya Srotas afflicted could be eyes as such. In that way, the Bahya and Abhyantara Srotas affliction has to be analyzed. Then regarding the assessment of ama in the body, text says, Srotorodha balabhramsha gaurava anilamudata alasya bhakti nishthiva malasangar chiklama lingam balanam samana, etc. By looking into that, we are going to identify the presence of ama in the body. When you think about the part of the body afflicted, we have to be very careful while taking the history properly. Depending upon the nature of the clinical manifestations, we are going to identify what might be the part of the body afflicted. Whether is it antaradhi, that is the thorax and abdomen, or whether is it the upper limb or urdhva shaka, or whether is it in the lower limb, that is adha shaka, or whether is it in the head and neck region, what we can say the urdhvanga as such. So that has to be noted by looking into the proper history itself. Based on that, the Roga marga involved that can be predicted. Let us say the example here. The person is having the swelling in the right knee joint. So that is, the dosha vitiated in this particular occasion could be kapha. As far as dosha afflicted here, that is asthi dhatu is being afflicted. If the person is suffering from chronic disease as such, there may be a possibility of a majja dhatu affliction also. And when you think about the srotas afflicted, in this particular occasion, it is the asthavaha and majjavaha srotas may be afflicted. As far as ama is concerned, ama may be observed in the knee joint itself. Of course, so here the ama need not be what you say that the macromolecules present in the alimentary canal, they are the modified forms that are going to get circulated in the bloodstream. That can be the ama as such because of the excessive walking, etc. So these macromolecules, they are entering into the right knee joint. So here, as far as part of the body afflicted could be, here it is the right lower limb. That too, it is the knee joint of right lower limb affliction can be seen. As far as Roga marga involved, so here in this particular example, as it is the sandhi and asti may be afflicted, so here the Roga marga affliction could be Madhyama Roga marga. Let us look into another example. The person is having breathlessness. In this particular example, here the dosha afflicted could be Vata and Kapha dosha. As far as dusha involved, it could be Rasadhatu affliction. As far as Srotas affliction, here it is either Asya or Nasa or Pranavaha Srotas affliction can be predicted. As far as assessment of Ama is concerned, so here Ama is specifically may be seen in the Pranavaha Srotas itself. As far as part of the body afflicted, could be it is the Asya, Nasa, Pranavaha Srotas, that is the Uras affliction can be observed. As far as Rogamarga afflicted could be, so here Madhyama Rogamarga affliction and the Bahya Rogamarga affliction can be predicted. And when you think about the overall relation between the Nidana, Doshavikriti and Vyadhi, so here that is termed as the proper understanding of these terms is possible when you are looking into the proper interaction with the patient in terms of the analysis of Nidana, in terms of the Doshavikriti and in terms of the Vyadhi. So that means we have to try to identify the Nidana exposure in terms of timeline properly. That is to predict the possible dosha afflicted, dosha involved in the body, Srotas dysfunction observed in the body, Srota Dushti observed in the body, Roga Marga involvement observed in the body, and Vyadhyavastha as such can be identified if your Nidana analysis is proper. For example, so here Shita Guna exposure. So here when you think about the overall the Nidana itself, so here Shita Guna dominance may be observed. Probably when you think about Shita Guna, three main rasa substances, that is Madhura, Tikta and Kashaya. Rasa substances, they may be having the Shita Guna. But here when you think about the food substance itself, here it is Tikta and Kashaya are usually not the present here. It is only the Madhura rasa substances may be observed in this particular ice cream itself, which may lead to the abnormal vitiation of either Vata dosha or Kapha dosha or Vata and Kapha dosha in the body. In that way, the possible dusha affliction based on the Ashraya Ashrayi Bhava, Asthi, Rasa, Mamsa, Meda, Majja, Shukra, Purisha, Mutra affliction may be observed. And depending upon the nature of exposure, Rogamarga affliction may be seen. That is, if the person is going to take the ice cream and part of it is entering into the nose, that may lead to the sneezing, cough, etc. may be observed. In that way, depending upon the exposure of Nidana, Bahya Srotas or Abhyantara Srotas affliction can be observed. And when you think about the Nidana, Doshavikriti and Vyadhi, they are actually nothing but the sequels. Exposure to Nidana that may take place. Because of the exposure to Nidana, that may lead to the abnormal vitiation of dosha or bioenergies in the body, either Sharirika or Manasika, which may lead to the manifestation of a disease as such. When you think about the small image here, Nidana Sevana. So here the person may be having the exposure to etiological factor in the mouth. So that is leading to the accumulation of this particular Nidana in the stomach for longer amount of time. On an average, 2 hours is the time period wherein the food may remain in the stomach for the proper digestion, which may lead to the increase of different gunas in the body itself, maybe ruksha or laghu or Shita, Snigdha, etc. etc. Thereby, there may be a possibility of abnormal dosha in the body, which in turn leads to the movement of these into the intravascular compartment. From there, it will be moving into the interstitial compartment. Later, it may enter into the intracellular compartment. Like that, there may be a possibility of manifestation of disease. To sum up, Nidana, Doshavikriti, and Vyadhi, they are actually interlinked, and this can be considered as Ahita Udarka. For this, you have to look into my video on Upadrava, Nidanarthakara Roga, and Udarka. So you will get the description there. And when you think about the Nidana and its functions, it will do three different types of functions in the body. That is dosha prakopa or vitiation of the dosha, or dhatu dushti or affliction of the dhatu as such, and kavaigunya. So in essence, Nidana, Doshavikriti and Vyadhi manifestation are the sequential events taking place in the body during the manifestation of the disease. Dear ANA community, that's all for today. What are the key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.